Medicine and Managing Director of Mental Health. I'm also the Secretary for the Society for Maternal-Fetal Medicine, India. Yes, you got it right. So I'm going to talk on a topic regarding surveillance for high-risk pregnancies. Well, the question is, what is an early pregnancy unit? Yes, it's a very, very novel concept. Initially started off in countries like the UK and the US. It is getting more famous or more relevant even in countries like ours, and that is because an early pregnancy unit is a comprehensive unit which dedicates itself for the care of all pregnant women who've had mostly some problems either during previous pregnancies or who are probably having some medical problems or pre-existing problems which could complicate pregnancy. And this clinic usually caters to pregnancies starting periconceptually even up to 16 weeks. It is manned usually by an obstetrician who's trained to handle medical as well as surgical complications complicating early pregnancy, or mostly the best thing is to have a maternal fetal medicine specialist who can handle the pregnancy both from the maternal as well as the fetal perspective. Apart from a maternal fetal medicine specialist, you also have a nurse who is not only trained to look after pregnancies but also has had some general nursing training, because some of these patients can have medical problems which need to be supported by a nurse who's exposed to handling these kinds of problems. Apart from this, you also need a sonologist. Sometimes a maternal fetal medicine consultant could be equipped with skills to perform ultrasound on these women, or you might also have a radiologist or a sonologist who liaises with you so that you could perform an adjunct ultrasonological examination which could add value to care in these women. Well, how does this early pregnancy unit add value in the management of any of these pregnancies which could be complicated? In fact, I would prefer that all women be looked after initially in an early pregnancy unit, and that is mainly because this particular unit acts as a triaging center. So there is, once a woman is registered in this clinic, a detailed clinical as well as laboratory investigations are performed based on the history or that is actually provided by the pregnant lady, and then this woman is triaged based on the reports, which also includes an ultrasound evaluation, to meet other specialists if required, because most of these complications that occur in the first trimester are usually complicated by immunological or endocrine problems which require assistance by the concerned specialists. So this clinic does it all because it manages to liaise with all the other specialties, adding value to care. That's particularly important because most of these women who've had these kinds of complications never know that they should probably approach a particular specialist or a particular, seek a particular care to improvise outcomes. And most of the times these women don't really find the relevant specialists and they might lose time fixing the appointments, and this clinic does it all for them. And very importantly, it's very, very relevant that this clinic liaises with a tertiary care center, because most of the time this clinic may not be hosted in a big hospital, and that is because you could have women with bleeding or an acute emergency approach to you, so you have an ambulance facility as well as a tertiary backup so that these women can be transported for further evaluation. So what I would say is these clinics are not like the regular obstetric clinics, and most of the times the time spent for counseling these women could be considerable, and definitely this kind of dedicated care and attention as well as evaluation adds value in the management of these pregnancies. And at Mirror Health, we're really happy to announce that we coordinate such early pregnancy units. So I offer this service to all those pregnant women or women who are yet to conceive, who've had any problem which could include either abortions or who've had a bleeding during pregnancy or who have complicated medical problems which are pre-existing and are wanting to get pregnant, to approach us so that we could start off evaluation and set up surveillance plans very early during pregnancy, which could have a definite impact to improvise their long-term or their ultimate pregnancy outcomes. Thank you.